Hello, I'm Marielle Ribeiro, and this is my patient assessment for the class NR 305.
Hi, my name is Elisa Spellmeyer, and I give in my permission to do this recording for school purpose at Chamberlain College of Nursing for grade.
Hello, how are you? My name is Marielle, and I'm going to be your nurse today. Today, here at the doctor's office, we're going to be assessing you. So, I'm going to be doing a physical assessment from head to toe. Is that okay?
Yes.
Okay, can you please tell me your name
My name is Elisa Spellmeyer,
and your date of birth?
April 3rd, 1953.
Okay, very good, Elisa. And can you tell me where you're at right now?
I am at the doctor's office for my assessment.
Very good. And can you tell me who the president is?
The president is Donald Trump.
Okay, very good. I can tell that Elisa is awake, alert, and oriented times 4. So thank you very much. Okay, as Elisa is sitting here, I am already assessing Elisa. I can tell physically by the way she is sitting up. I can tell, her nutritional factors. She is not too thin. She does not seem to be overweight. So just by those things, I can already make an assessment about Elisa. So the next thing I want to do is, Elisa, I'm going to go ahead and I'm going to assess your head and your face. Is that okay?
Yes.
Okay,
Yes.
so going ahead and assessing and palpating her scalp. I don't see any lesions, no tenderness. Here I can evaluate Elisa's hygiene. Her head, she has a full head of hair. She doesn't seem to be, missing hair. I don't feel any foul smell coming from her. So I'm also going to be assessing her skin for any lesions, any abnormalities that I may see, which I don't. Very good. So Elisa, the next thing that I'm going to be palpating is your temporal mandibular joint. Is that okay?
Yes.
Okay. Here, I'll put your. Okay, so go ahead. Open and close. One more time. Okay, very good. I see Elisa, everything is symmetrical. I'm looking at her eyes, I'm looking at her nose. So the next thing that I'm going to do is I'm going to go ahead and I'm going to assess your eyes, your ears, your nose, and your mouth, including your throat. Is that okay?
Yes.
Okay, so I'm looking at her eyes externally and I see that they are symmetrical. Her sclera is white. Her conjunctiva is pink and moist, which is exactly what we want. Now I'm going to go ahead and I'm going to shine this light in her eye, okay? And her pupils are equal, round, and reactive to light and accommodation, so very good. The next thing, I'm going to go ahead and I'm going to assess Elisa's ear. And I'm looking for the orisal, the tragus, and the lobule, which a little nodule there, but that's consistent with the ear piercing. Thank you very much. And now your nose. Is it okay if I touch your nose? So I'm going to go ahead and palpate the patient's nose. Are you feeling any tenderness there? Okay, and the nose is symmetrical. Now, if I can please just have you cover one nostril with a finger and blow for me. Breathe in and out. Very good. And go ahead and do it the same with the next one. And here I'm just assessing the patency of the airflow. Very good. Now I'm going to be assessing her mouth next. I'm looking at the lips, which they are also symmetrical. Okay, if I can have you smile for me. Very good. Open. I see her teeth are intact. Very good. I'm looking at the gums, which appear to have no bleeding. The buccal mucosa, which is pink. Okay, very good. If you can stick out your tongue. All right, we got a nice hydrated tongue, and the back of the throat, the tonsils, and the uvula is intact. Very good. Thank you so much. Now, the next thing that I'm going to be assessing is your neck. Okay?
Okay.
So, beginning here, I'm going to actually begin with the pre-orisal, and I'm going to palpate the post-orisal. I'm also going to go ahead and palpate the occipital back here. Okay. I'm going to go ahead and I'm going to palpate the tonsillary. Okay, good. We also want to make sure we aren't ever palpating the carotid at the same time, okay? So I'm also going to be checking for nodules here under the neck, submandibular and submental nodes, which good, very good. Okay, everything seems good and feels normal there. All right, Elisa, the next thing that I'm going to be assessing are your upper extremities, okay? So now the first thing, if you can just put your arms out, I just kind of want to see the temperature of her skin. It's not too cool, it's not too hot, okay? That feels good. I'm also assessing for her skin for any abnormalities, any lesions, okay? Now the next thing, bilaterally, I want to check her pulses. So I'm going to go ahead and begin over here with the brachial pulses. Okay, nice and intact, a +2. I'm going to go ahead and move to the radial pulses. Very good, +2 there too, and the lunar pulses, which are bilaterally intact, very well. Now the next thing that I want to do is I do want to check for your capillary refill, okay? And those are very good as well. Now, Lisa, I would like to test the sensation in your upper body. So what I'm going to have you do in a moment, I'm going to have you close your eyes. And I'm going to go ahead and I'm going to lightly touch you like this with the cotton ball. And every time I do, I want you to say, okay. Do you understand?
Yes.
Very good. Go ahead and close your eyes. Thank you.
Yeah. Okay. 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 Okay.
Very good, Elisa. Okay, so the next thing that I want to do is I want to go ahead and assess your posterior chest. So if I can just have you go ahead and stand up for me. Okay, and face this way. Now, every time I'm going to go ahead and I'm going to listen. Every time I move the stethoscope, please take a full breath for me, okay? Now I'm going to begin up here at the apex. Okay, very good, Elisa. Thank you. Now, if I can just have you face this way, and now I'm going to do the same thing. But what I'm going to do is I'm going to be listening to the anterior chest, okay?
Okay.
Now, again, every time you do feel me move the stethoscope, I need you to take a full breath. Very good, Elisa. Go ahead. You can go ahead and take a seat. So now I'm going to go ahead and I'm going to be listening to different points in your heart, okay? I'm going to begin in the aortic area and the pulmonic area, which can both be found in the second intercostal space. Then I'm going to move on to Erb's point, which can be found in the third intercostal space. Then I will proceed to the tricuspid area, which can be found in between the fourth and fifth intercostal, and then finally the apex or the mitral, which is the PMI, the point of maximum impulse, which is found in the fifth intercostal space, and this should generally be listened to for a full minute. So, aortic, pulmonic, Erb's point, tricuspid, and the mitral. Very good, very good, thank you. Now for this next part of the examination, I am going to do the abdomen. So if I can just have you please go ahead and move over here. Now, as the patient is laying down, the first thing that I want to do, I do want to visibly notice the contour of the patient's stomach, which seems flat. We don't have any obesity going on here, a little bit rounded, and we have the umbilicus medial to the abdomen, okay? Now, when we are assessing the abdomen, one thing that we want to do is we don't want to start percussing or palpating before we haven't actually listened to the bowel sounds. So I'm going to listen in all 4 quadrants, and I want to listen until I get a bowel sound, or at least 5 minutes if I'm not getting a bowel sound. Now, if you're not getting a bowel sound in any of the quadrants, that will be concerning. So we're going to listen until we hear something in all quadrants. Okay, very good. Now the next thing that we want to do is we do want to percuss the 4 areas of the abdomen, which they should be tympanic in all 4, except when they should be tympanic in all 3, except on the 4th when you're moving over the liver, you should hear more of a dull sound. Now the last step that you do want to do is you want to lightly just palpate in those 4 areas that you were listening for. Okay, that seems good. Now, Lisa, while I have you laying down in this position, I'm going to go ahead and I'm going to assess your lower extremities, okay?
Okay.
All right. So moving over here, I do want to, again, touch her skin, and it seems good in body temperature, not too warm and not too cool. Okay, the next thing, bilaterally, I do want to see that her pulses are intact. Okay, so I do come here, and the dorsalis pedis are at a +2 and they feel intact and good. And then we move over here and I'm going to go to the posterior tibial pulses, okay? Which are also a +2 and intact. Now, Elisa, the same thing we did with your upper extremities, I'm going to do with your lower extremities. Just simple cotton ball. I'm going to have you close your eyes, and whenever you do feel me swishing the cotton ball, I do need you to say okay. Is that okay?
Okay.
All right, go ahead and close the eyes.
Okay. 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 Okay.
Very good. Now, for the last step of the assessment, Elisa, I'm going to just have you stand up, and I need you to walk for me. I'm going to go ahead and just see your gait, see if everything is okay. Very good. Very good, and come back this way. Very good, Elisa. I don't see any unsteadiness in your gait. Now, I'm going to assess for your balance. So this next test is called a Romber's test. So what I'm going to need you to do is put your feet together this way. Very good. Let's have your arms out just a little bit that way. And in a moment, I'm going to have you close your eyes and just stand still. And I'm just going to see if there's any swaying or swishing motion going on. Okay? All right, go ahead and close your eyes for me. Okay, we see Elisa. We don't see any swing. Okay, Elisa, go ahead and open your eyes for me. Very good. Now, the last step of the test, we're going to just see your coordination in your upper extremities, how you're doing. It's called a nose to finger test. What I need you to do is grab your finger, put it on your nose, please. And now, wherever I move my finger, I'm going to ask you to, with the tip of your finger, touch my finger and back at your nose, and I'm going to move it around, and you're going to do the same thing. Do you understand?
Yes.
Very good. Go ahead. Touch my finger. Very good, Elisa. Thank you so much. That concludes our part of our head-to-toe physical assessment. Do you have any questions for me?
No, you are awesome. Thank you very much.
Thank you, Elisa.